Good morning, dear colleagues. We start our working day at Ukraine Crisis Media Center, and the topic of the first press briefing is the results of testing for hepatitis C. Welcome on stage. Good afternoon, dear friends, dear colleagues, representatives of mass media. I am Pavlo Skala, Policy and Partnership Director, Public Health Alliance, and today we have a short press briefing, and we want to share the results of hepatitis C testing. We carry out this testing for the 5th year to mark the day. This is the day of fighting against hepatitis, and we carried out some testing, and 26 towns participated, and of course we didn't carry out tests in Donbass that is occupied, and in Crimea. Traditionally, we counteract AIDS, HIV, and also we deal with tuberculosis and hepatitis C. We started in 2012. This was the first campaign, and before there were no data about hepatitis C, and for the 5th year we may say that this problem is known, and from our press release you may see that we are speaking about the war against unknown enemy. And you will get information how Ukrainian state fight this problem, because we have enemy in the east, and there is also some invisible war, and the situation is difficult. We have problems with state programs, with financing of the state program, and today we are going to speak about it. Also, during previous years we tested population, those people who came to locations where testing is going on, and last year we carried out this testing because the situation is acute. That's why we made some testing among ATO participants, National Guard officers, and we tested 3,000 of such people, and we got high results. This was 4% of positive results, and this year we decided to test population, and we didn't make exceptions for servicemen of ATO, and also there was press briefing in Shevchenko Park, and this problem was voiced there. And I would like to, before giving the floor to our main participants, head of the Alliance and representative of the Ministry of Health, I would like to announce the results, and they are evident on the slide that will be shown on the screen, and also it is present in the press release that you have. Please open slide with the results of testing. We tested more than 3,844 people, and we got positive results 324. That is about 8.5%, and this is high number that correlates and supports our previous testing, all Ukrainian testing, and it shows that there is high level of threat of spread of such infection, and the situation can become epidemic. So the most serious problems and indicators 15% in Kiev, more than 15% in Khmelnytsky region, more than 12% in Zaporizhia Oblast, in the Dnipropetrovsk Oblast. And as to numbers, in Kherson we carried out 80 tests and 225 in Volynsk. This is the biggest number of testing, and in Kiev it was 198 testings. We got such results in the framework of such campaign, and we got these results that shows the threat. And I would like to give the floor to the head of International Alliance on Public Health, Andriy Klepikov, and also the Medical University representative, Professor Olga Golubovska, Professor and Chief Non-Staff Infectious Diseases Specialist. So please, you are given the floor. Thank you. Dear colleagues, the results that we have, the results of testing, that 8.5% of Ukrainians on average showed positive results of testing, hepatitis C testing. So this is the information that is a request to our Ministry of Health and to the public. We should be concerned at this. Why the situation is so difficult with hepatitis C in Ukraine? Of course, there is a problem of underfinancing of state program. Recently, yesterday, we got the answer that all Ukrainian program is underfinanced for 79%. So the situation should be improved. But the situation is really difficult because the development of new programs is frozen. And in such a situation, our alliance made a request to the President of Ukraine, to President Poroshenko, asking him to initiate the development of national plan to eliminate hepatitis C. Hepatitis C is a treatable disease, and according to the estimates of international experts and also World Health Organization, the number of people who suffer from this disease can reach 4 million of our citizens, and this is shown by the results of the testing. So in such a situation, there are countries that adopted such plan, and they get rid of this disease, like from other diseases like malaria, TB, and in the past they got rid from the plague. So hepatitis C is a treatable disease, and in order to do this, we need political will, a plan, a strategy to eliminate hepatitis C. Secondly, financing. As to medicines, Alliance started a program of treatment with the use of new drugs. So these are the medicines of direct antivirus action, and more than 600 patients were treated, and now more than 1,000 patients is treated, and the results of treatment at 93%. So this is the highest rate in the history of hepatitis C treatment, and we have highest results, 93%. And after treatment, in 12 weeks, this is a standard of World Health Organization, this virus is not revealed, so the patient is considered to be treated. So this can be done, and we proved that this can be done in Ukraine, treating patients in our clinics by new medicines. And lastly, I would like to say that all the stakeholders, all the interested parties, both civil society and the Ministry of Health, and also our citizens, we have single opinion on this. We should get together and we should eradicate hepatitis C in Ukraine. Thank you. Thank you, Andriy. And I remind that here present is the chief infectious disease head of Infectious Disease Chair at National Medical University. Firstly, I would like to thank the Alliance for their active work, for their information campaign and testing that helps us to reveal the number of patients, and they do this for many years. And they started it in those years when these problems were not of concern to anyone. And to support the results of the testing, I would like to present the data of our center. And for tens of years, they tested the groups of population, and in different groups, the number of infected in Ukraine 3 to 70%. So what are the major groups? Please pay attention. So the level of infection, 22%. The patients of who are drug dependent, they have up to 70%. People who frequently get ill, they have the level of about 15%, and that's why we told about it, and we convinced international organizations and World Health Organization that the level of infection is in Ukraine is more than 3% than they told us about. And in 2013, I cite this review of our colleagues, and it showed that the level of infection in Ukraine is average. And starting from 2013, our international partners told that the level of infection in Ukraine is about 12%, and the number of people who are ill is about 9%. And we should take into account that this testing that was carried out by the Alliance is the spread of information about spread of infection, but not all who are infected get ill, despite this virus having really big potential, and in 75% it forms chronic forms of illnesses. And in many years there are tragic consequences of this virus for a person, but 15% can get rid of the virus, and that's why the level of infection is about 9–10%. I mean patients who are ill, like in Europe. So all the countries of Eastern Europe has the more higher level of infectious diseases, and they have the higher rates. About treatment, why elimination is possible due to WHO. Now these hepatitis, they are treatable, and they introduced the medicines with direct action on the virus. And these medicines reduced the number of therapy down to 12 weeks, and also increased response up to 90%. The majority of people, they become healthy after this treatment without some side effects. And due to cooperation with different pharmaceutical companies, Alliance provided therapy to the most vulnerable patients, key groups of the patients, because without helping these groups, it would be impossible to eliminate this disease. So they dealt with the most vulnerable groups, such as drug addicts and others. And we have wonderful results of this treatment, more than 93%. These are the most difficult patients with terminal stages of these illnesses. Due to our joint actions, we reached the result, and the costs for these new drugs were reduced, and in the framework of the state program, our patients will be able to get this year. Only now we have these medicines in the region for the first time. It happened so. They will get these medicines. And in 2016, also we have medicines without interferon therapy. And as a conclusion, I should say, in my opinion, the program, the state program, as it is now, it is not needed. We should write elimination plan that was adopted on the 21st of March this year by World Health Organization, and we should complete and follow this plan. And starting this autumn, we will start this work, and all the members of WHO will sign appropriate documents, and after this we will form a system of elimination. That is what it was rightly done with malaria. That was endemic for Ukraine, and now we don't have it. So if you have questions, please ask. Thank you. So we don't have time for questions. All the questions, all the issues you can find in the diagram, in our press release, and also the stories of the patients. I would like to remind to you that more than 80% of hepatitis C are the new cases. Those people who came that didn't know that they were infected, and there were many elderly people, and there were some unexpected cases, and you can find this information in our press release. And maybe we have some 5 minutes. So please introduce yourself first and be brief. Irina Markevich, 1+1. Maybe some questions. Is this sampling is the representative, and can we say that 8.5% is overall disease? How can you explain this high level in Khmelnytskina? And this new treatment you are talking about, it is known that treatment from hepatitis C is very expensive. What is the price of the course of this treatment? The results of this research, they are not such sociological, and they are not scientific, but there is representation. We can compare data starting from 2012, and the main trends are proved, that the most difficult situation is in the east and in the south, but also there are some oblasts in the west and in the center of Ukraine. This year we have Khmelnytskina. Partly it can be connected with the people who were tested, because we were speaking that the level of infection in different groups differs greatly. For example, among those who use drugs intravenously, it is really high. And also we see that high level of infection is also in large cities, such as, for example, Kiev. And as to these campaigns, we saw that these are mainly young people, students, who were tested. So this is these are the people who underwent testing for the first time. So when this new treatment appeared several years ago, the price in the United States was $86,000 for treatment. And we, Alliance of Public Health, we bought these medicines for $900. So this is 1% from the price in the United States. And also due to the negotiations with the Ministry of Health, this price will be the same and even lower for a state. So I should say about the treatment, I will be brief. The price will be lowered. This is the price that we see in different European countries. The prices are different. But the most so this medicine costs about $86,000, so people cannot afford it. And but we are speaking about state procurements and Public Health Alliance procurements. So the main problem we are facing is that in the market of Ukraine, there is an inflow of generics that are not properly registered. We are not against generics. And the position of WHO and our position also that we cannot eliminate this disease without generics. We should reveal those who were infected, so we should improve our system of testing and control. But the doctors that prescribe these drugs and patients who take these drugs, they do not know the quality of these generics. And when the people use these medicines of direct use, there can be resistance develop. And the hepatitis virus is so that it can be resistant to treatment, because this virus is really difficult to treat. And once a week I get information that they were treated by generics and the disease restarted and no one can say what to do, and there are no resources for this. That's why this is the matter of law enforcement bodies, but the state should provide quality of medicines, not the doctors who prescribe the medicine or the patient who buy that medicine for his or her own means. But there are good generics, and without these generics we won't cope. And the last remark about representative qualities of our research. Kiev Oblast, 200 people were tested in Kiev. It was done near Shevchenko University, and also Irpin and Vasilkiv were tested, and both cities of 150 testing was carried out, and in Irpin we have 12.5%, and in Vasilkiv about 3%. So you see the difference in one oblast. It differs from the town, the city, from the target group, and there are some specificities, and we are really grateful for attention and for providing this important information to our viewers. And also, I would like to thank to the heads and workers of NGOs in all these 26 towns and cities of Ukraine who joined this campaign, who carried out this testing, because we prepared this event for 3 months, and this is really a great event, and we carried out it, and we are grateful to them, and also for local government, and we hope that the results of this year's testing will influence local and regional programs and on financing of these programs, and also because people without knowing their diagnosis, they cannot be treated properly, and a person should know his or her status. And we initiate an international campaign that is known as Know, Test, and Treat. And we ask and call on you to know, to be aware, and to treat, and we will help them in this, and we will demand from the state that it should provide, and they should fight in this invisible front, and it should win. So you can address our speakers individually in order to get comments. Thank you. Thank you, dear colleagues. And I remind that our next press event in 3 minutes.